Welcome to pharmacology lectures. Now we were studying about the receptors, muscarinic receptors. Okay, here we are shown the muscarinic receptors. These are divided into M1, M2 and M3. Now for these are muscarinic receptors. Okay, this and this. It is shown that acetylcholine also binds with the muscarinic receptors, and muscarine, an alkaloid, it also binds to the muscarinic receptors. It also has a low affinity towards nicotine. Okay, but the other type of receptor, that is nicotinic receptors, here nicotine binds to the receptor, acetylcholine also binds, and low affinity towards muscarine. You can see here muscarinic receptors bind to muscarine, nicotinic receptor binds to nicotine, high affinity towards these. Now first of all we will study mechanism of acetylcholine signal transduction. How does the signal pathway occurs? M1 or M3 receptors are activated. The receptor undergoes a conformational change, which because these are, once more, these are G coupled protein receptors. We have seen in the previous lectures there are various types of receptors. This muscarinic receptor is G coupled protein. So once the receptor complex is activated, the change happens and interacts with the G protein, which activates phospholipase C. This ultimately leads to the production of second messenger. These are the second messenger, inositol 1,4,5 triphosphate, IP3, also we call it as IP3, and DAG, diacylglycerol. IP3 causes increase in calcium ions, which will interact to stimulate or inhibit and cause hyperpolarization or contraction. Now DAG activates protein kinase, an enzyme, and that phosphorylates numerous proteins within the cell. Now this was about M1 and M3. What happens in the M2 receptor? M2 subtype is a cardiac muscle, so it stimulates and inhibits adenylyl cyclase, which increases potassium. There was calcium and here it is potassium due to the cardiac. The heart responds and decrease in the rate and force of contraction. This occurs in M2 heart muscles. Now once you have understood the mechanism, M1 and M3 and M2, M1 and M3 hyperpolarization occurs or contraction. In M2 rate and force of contraction is decreased. Now agonist, we will see here agonist, muscarinic agonist. We have studied in the first, pilocarpine is a non-selective. It is not a selective, it is non-selective, and usually it is used to treat glaucoma. This is an important question you have to remember. Pilocarpine is used to treat glaucoma. Next receptors are nicotinic receptors. Now here the mechanism of action is, okay, diagram is not here, okay, we will see here. Now we have seen nicotinic receptors bind to nicotine with high affinity, also binds to acetylcholine, and a weak affinity for muscarine. Now nicotine receptors have 5 subunits, and that was muscarinic was G coupled protein receptor, and this is ligand gated ion channels. Okay, here, yes, ligand gated ion channels. Binding two molecules to acetylcholine will produce a conformational change, and it will allow the entry of sodium ions. Since it is a ligand gated ion channel, so it will allow the entry of sodium ions, and this will then result in depolarization of the effector cell. Nicotine at low concentration stimulates the receptor, whereas nicotine at high concentration blocks the receptor. You have to check it out. Now where are these present in the CNS? Adrenal medulla, autonomic ganglia, neuromuscular junction in the skeletal muscles. Those of skeletal muscles are known as NM and M, okay, for muscles, and the others are known as NN. Now the receptors of autonomic ganglia differ from those of NMJ. For example, ganglionic receptors are selectively blocked by mecalimine. whereas NMJ are blocked by atracurdia.